Hey, I know your pain. I was feeling the same way not long ago. I'm here to help you. In the following minutes, I'll show you how I was able to transform my life. Watch this closely and thank me after that.
How do we treat depression? The most common form of treatment for depression is the use of antidepressant medication. Nobody can say for sure, at this moment, why antidepressants can alter a person's mood. Because nobody knows for certain exactly how antidepressant medication works. It is thought that by increasing or decreasing certain chemicals in the brain, such as serotonin, that this has an effect on the brain's neurotransmitters. Currently, 10% of all Americans over 12 years old take antidepressants daily. Among females in their 40s and 50s, that figure increases to 25%. Approximately 254 million prescriptions were written for them in America in 2010, resulting in nearly $10 billion in costs. This figure rose dramatically in the years that followed. Antidepressants do not cure depression. They lessen the symptoms, for a minority of people who take them. A recent report published in the Journal of the American Medical Association stated that the drugs work best for very severe cases of depression, but have little or no benefit in less serious cases. It is thought, though, that the overall success rate of the drugs is approximately 36%, slightly higher than that of a placebo. Antidepressants are also known to have side effects for the majority of people who take them. Patients will usually experience one or multiple of the following: nausea, increased appetite and weight gain, loss of sexual desire and/or other sexual problems, erectile dysfunction and decreased orgasms, fatigue and drowsiness, insomnia, dry mouth, blurred vision, constipation, dizziness, agitation, irritability, anxiety and increased risk of suicidal thoughts and behavior. Antidepressants come with no guarantee that they will work on any level of success. Further treatment options include counseling, psychotherapy or talk therapy. This has a much higher success rate than antidepressants overall, but again the figures at hand vary wildly. The cost of seeing a counselor, therapist or psychiatrist is also very high. The average is around $150 to $200 for a 60-minute session. It is not unusual for these professionals to charge upwards of $500 for an hour's session. And the sessions usually need to be on a regular weekly basis to have maximum chance of success. There are other treatment options. It is interesting to note that many health professionals believe there are much better ways to treat depression. Irving Kirsch, the associate director of the program in placebo studies and a lecturer in medicine at the Harvard Medical School, is quoted as saying, "Depression is a serious problem, but drugs are not the answer. In the long run, psychotherapy is both cheaper and more effective, even for very serious levels of depression. CBT or cognitive behavioral therapy has a much higher success rate than medication. Studies have shown it decreases severity of depression in most patients who maintain a CBT course, with many patients reporting they never relapsed into depression. CBT-based self-help books sees an even larger percentage of success rates, and numbers of people reporting to be cured with very little cost involved. So why is this form of treatment not more widely used? It seems the answer is quite simple. There is nowhere near as much money to be made from curing depression as there is from helping people live with it. Due to the pharmaceutical and medical industry's wide-reaching influence and the money involved, health professionals who deal with depression and other illnesses are afraid of offering a treatment which may upset those powerful companies. Very few are willing to publicize findings that depression can indeed be treated naturally, safely, extremely cheaply and in just a few weeks. One of these few researchers who dares to go against the current trend is James Gordon, a UK-based researcher and former depression sufferer, who is doing a lot of work to try to make these findings available to the general public. He is the creator of the Destroy Depression System, a simple, 7-step guide to self-curing depression naturally, using an amalgamation of all the research done in the area, together with his own self-experimentation with which he cured his own depression. Check out the link in the description below to get your copy of the program. Click the link below. Get it?
Cool, right? Call us or click the link below. We look forward to working with you.